Hello, and welcome to another episode of the Move.Talk.Thrive podcast. Today, we are looking at external visits. We're going to look at the different types of external visits, the things to consider, and just some strategies around getting great outcomes in different environments. All right, let's look at external visits today.
We are child development obsessed, business besties, and mums, and we're here to spill all our secrets.
We have a combined 30 years experience working with children, and each episode we will bring you up-to-date research and evidence-based strategies to set your children up to thrive.
I'm Lizzy Dawson, Australian exercise physiologist.
I'm Emily Mackie, Australian speech pathologist,
And this is the Move.Talk.Thrive podcast.
Hello, Emily.
Hello, Elizabeth. You don't often call me Emily, so using your formal name, Lizzy. How are you today?
I am great. I've had a good day. How are you?
Yeah, I've had a really great day too. I have had some time with my children. I've done some work
Nice.
today. So a bit of both, a bit of a balanced day, mum life and work life, which is nice.
Nice.
Nice, yeah.
I've been all in work today, like just going hard. And then I'm going for an early dinner with Pete tonight. So I'm kind of excited. So not a mum day at all. I'll be home to put them to bed, which I like to be there when they wake up and when they go to bed at the very, very, very minimum. But yeah.
Yeah, nice.
Now
It
you're making me
changes.
feel bad.
No, it changes on a daily basis, right?
Yeah,
I'm
totally.
going to a conference for the next 2 days, so I won't be with the kids the next 2 days.
Yeah.
So, it's all a balancing act, and
Yeah, for sure.
children don't know the weekend from a week. So you've just got to balance it over like continuous days, really.
Yeah, for sure.
So today we're talking about, well, we've titled it external visits. Well, that's what we are calling it. But really, I mean, in the speechy world, it would be like preschool visits or school visits that people would often be talking about. What would EPs be saying? Would they say external visits?
No, they would not say external visits. They'd say home visits. And hydro would be another extra, like outside of the clinic, I guess. If we kind of blanket it of everything outside of the clinic, you'd have your clinic visits, and then you have home visits. You would have maybe like in aged care facility, but I'd kind of put that with home visits. And then you'd have things like hydrotherapy, or out on the field, I guess, like sports or something like that. My particular business goes into schools and early learning settings, as we know. So I am fairly familiar with it. But yeah.
Yeah, so external visits, that's why we call it external visits, because it encompasses so much, but we probably wouldn't use that terminology on a day-to-day basis. However, we are starting to introduce it at Speak About using that terminology. Yeah, external visits, yes. So let's go back. I'm going to say 12 months. I'm going to say 12 months at Speak About. So we have even further. Let's go back even further. So when I first opened Speak About, I had a few schools come and approach me, and they were like, do you want to do therapy in the school? I was like, let's see if this could work, because it's mostly logistics, which is a bit tricky. So I went to a particular private school, and it was just very difficult with the logistics, like in terms of needing a space, having time for the students, having time to go and collect the students, even knowing if a student's sick, and then you go there and you're like, oh, no one's informed me, and I've spent 10 minutes running around trying to find their class. So there's a lot of logistics like that for it was a private school, so it was primary school and high school. So there's a lot of logistics like that. And then at the time when I was opening the business, I was like, this is too much, let's just come in-house. And then we were approached to work in a preschool. So that was like maybe 5 years in to Speak About. And so then we did have a therapist employed full-time working out of a preschool, like they had their own room in the center, and we had a few logistics with that. But it was fine. Like we were able to work it out as we were a presence in the center. So that was better to have the speechy in there. And so then if we fast forward then to about 12 months ago, we sort of revisited the topic. There are a few speeches coming in for job interviews with us saying, in the job interviews saying, do you do, not external visits, do you do school visits? I really want to work in a school as well as a clinic. And I was like thinking to myself, but what if that doesn't suit the child? For you to do a school visit? Like, you know, I was pondering this sort of concept of all these speeches coming in to the interviews saying, I want to split caseload, like I want to work in the clinic and I want to work at schools. I want to work, well, it was only schools, right? To either preschools or primary schools. And I was just thinking, like, clinically that just doesn't sit well with me. And why does that not sit well? Like, I needed to really like reflect. And so when I was just pulling it apart about like how I felt, my experiences, you know, taking aside the logistics, the reason why I realized that I was like, I don't know how I feel about that, was because I was like, we're actually asking the wrong question and we're focusing on the wrong thing. And I guess if you're a new grad and you're listening to this right now, listen up, listen up. Because what I realized was we shouldn't really be saying, oh, I want to work in schools or I want to do all preschool visits. Because at the end of the day, it's fundamentally not about the visit. It's not about it's not about the school. It has to start with the child first. And so if at Speak About, I then took it to my leadership team and I was like, right, we need to flip this on its head. We're going to call it external visits because it's no longer just a school or a preschool, because why would we go into a preschool if the child's not going to perform well there? Why are we going to go into a school if the child's got anxiety at school? Why would we do that? We're not just going to put a blanket over children and be like, just because we want the experience, we're going to do that. And I was like, let's coin it external visits and let's start with the child first rather than the facility. And let's think about, okay, the child's therapy journey, and then think about, okay, if we're going to do an external visit, why would we do an external visit? What benefit would that be to the client? What benefit would that be to their progress? Not so much the parent, even though the parent has a factor in this because many parents are working. However, ethically as a speech pathologist, if a parent's working and you're seeing a child in preschool and getting no results because preschool is overstimulating and it's too distracting, or they've got anxiety at school, that's not really going to help a working parent. So we have to think about the child first if we're really wanting to do the right thing by the child. And then what we need to do is think about external visits as, where am I going to best get the result for this child in their everyday external visits and activities that they're doing. So before I had kids, I didn't really think about this because I didn't know. But now after having children, I'm like, right, we're at playgroups, we're at preps, we're at preschool, we're at creative sport activities, we're at swimming, we're at library, we're at like lots of children in the Hawkesbury, they do horse riding, you know. And so I'm like, let's think about what the child's goals are, what they need, and then where would be the most appropriate place to do the external visit, not just go, I want to work in a preschool or I want to do school visits. That's my piece. Now you can speak, Lizzy. I've just monologued for the first part.
No. I was listening. I was listening and kind of reflecting. I think it's really interesting because I think that this has sparked something in you because you've had people coming in and specifically ask for school visits. I've never had someone come in and specifically, like an EP, say, come in. Well, I mean, traditionally we don't really do this. So, but I guess it's kind of like them coming in and saying, I only want to do home visits, or I only want to do hydrotherapy, or I.
That would be the equivalent.
Yeah. Because it's just unlikely that someone would apply and say, I just want to work in the kindergarten or the preschool.
Or it might be like, I want to do 50% of my caseload on hydro and 50% in the clinic. And you're like, well, that's unrealistic because I don't know which clients are going to need hydro and which clients are going to need to be in the clinic.
Yeah. And interestingly, we had this hydro, like, because we offer hydro at Northside. That's like, we have a morning of hydro and we just put all the clients that need hydro into that morning. And we were doing the same with Kids Heart Pilates, but it was too difficult because the availability of the kids and the logistics of getting them to the pool for one block wasn't really working. I'm just kind of like reflecting on what you're saying. But I think interestingly, maybe a little bit differently to you, because we work in a lot of kindergartens, and we basically cater to what the family wants and the way that they're going to get access to us, I guess. So we say, you can come to the clinic, we can come to you, we're in this area on this day, and we kind of work out if it works. Where we used to be all mobile until last year. I've got 3 cars operating that the girls are in all day. We are on the road all day and then pretty much in the clinic in the afternoons. So yeah, but that's kind of just how it's evolved for us, I think. But one thing that I think is interesting that's kind of coming up for me when you're talking about it, and that is that we go into kindergartens and we were trying to do one-on-one therapy in a kindergarten. And I had the kindergarten call me and say, we can't do one-on-one therapy in the kindergarten. The kindergarten is a facility where the child comes and practices their social skills and has a social experience with other kindy children to explore whatever we're exploring and experience whatever we're experiencing, and to single out a child and take them separately takes them away from that kindy experience. So if you're coming into a kindy, you as clinicians need to have the skills to be able to practice your therapeutic activities, interventions in a group environment. So
yes, absolutely.
yeah.
Yes.
So I think this is a really important aspect of going into like an early learning setting, which may kind of make it more challenging for your clinicians, because you need to have the skills to be able to go in and be able to observe how that child is behaving in that early learning setting and enriching their experience, which is experience with other children. So I think you need to be able to perhaps if they're playing blocks, like go in and play the blocks and bolster that child specific experience while they're interacting with other children, not necessarily getting a one-on-one therapy session. So I think that's something that just came up to me while you were talking then, because I think that's really, really valid and important.
And that's exactly what I'm talking about. Like, you have to be going into those settings because that's the goal. Like, the goal that you're working on is going to be best facilitated in that setting. So that's exactly what I'm saying. Like, we wouldn't go into a setting and pull the child one-on-one because what is the goal we're working on? Like, if we're just working on a goal that can be done in a clinic or in a quieter, like, it would probably be better done in a clinic because it's a quiet environment. It's a contained environment. Whereas the goal is that if you're going into an external visit, you need to be clinically rationalizing that by saying, I'm going into the preschool environment because I'm working on a social goal, or because I'm working on a goal which requires me to observe how they're playing with other children and to teach them to generalize this skill while they're playing, because that's what they're generally doing in those settings, or to help them in their transitions and understand instructions in transition. So it's looking at, like, generally if we're going to external visits, it's because we're trying to get the functional application of those goals. And then, but it's because we've done it in therapy, or we've thought about it and we thought about the child first and we've thought about the goal. We haven't thought about the external setting first.
Yes.
We've thought about the child and their progress first. And then we go, how can we facilitate that progress? So, that's, I think, being at home as well, like, with your home visits, sometimes it's not really good to do therapy at home for the child.
No.
Children don't benefit from that.
And it's also quite difficult to run. So I think I definitely think that external visits definitely have like a layer of skills that are probably not really considered.
And we have talked a lot, I think, on different episodes about different levels of skills, like from talking to
Yeah.
parents to managing behavior to managing transitions
Yeah.
to dealing with conflict and things like that. So all of those skills together can make your external visits go really well. I
Yeah.
think you learn a lot of those skills in clinic, and then they're like it's generalization of your skills as well in external visits, because how if you go to an external visit, how do you talk to a parent if you can't talk to a parent in the basic environment of a clinic where you've got your colleagues there with you supporting you, or you feel
Well,
like you're
they're
a bit
not
more.
there. The parents aren't there because you're going into an education facility. So you've
Yeah.
got to have a whole nother line of communication. Because we do like this is, half of my
Mm,
business is to go into like to do external visits. So there is a whole another level of communication that needs to take place. We will always text parents if we're not seeing them so that we're just giving them an update like, hey, little Johnny did really well today. He responded really well to this, this, and this, struggled with this or whatever. Just say that they know that we're seeing the
mm.
child and what we're actually doing,
Communication's
because you
different,
don't
right?
have that,
Mm.
you don't have that just incidental, hey, how you
Conversations.
going? Yeah,
And that's
exactly.
a really important thing you need to consider if you're going to do a preschool visit or a school visit or school therapy. Yeah, I guess a visit would maybe mean like a one-off if you're doing actual therapy, like with the child in the
Yeah.
school, or like it's continuous for a term or a few sessions, because you need to also be accountable to the parent because they're paying for that as well and they want to know what you're doing, right?
Yeah, and I
That's
think you also need to be able to communicate to the parent that piece on other children are going to be involved. Now, most parents, that's the reason why they want to do it,
Mm.
but some might be doing it purely from a convenience perspective. And I think that that's really important to communicate is that, if other children are getting involved, that we encourage that, because that's part of the skills that they're developing in a learning setting, and it's
Mm.
quite important. So I
It's a
think.
really big dilemma, ethical dilemma, I think, because
mm,
we do need to support the parents, and intervention is better than no intervention. So because
mhm,
like what's the alternative, right? So a parent brings the child after the child's had a full day of preschool, at 5 o'clock or 5:30, which the child's wiped out, so that's not helpful. But then you
mhm,
do the intervention, say at 10 o'clock, and the parent's not there in the preschool, where the child, like I look at all of the children that I've seen in therapy, and I would confidently say that not all of them needed all of their therapy done in the preschool. Like it would have been more
mm,
like some elements of the therapy might have been better suited in a quiet environment, in a structured environment. Other elements of therapy are appropriate in the school. So it's looking at that ethical dilemma and going, how do I make this work with a parent who is working and getting the
yeah.
best, but getting the best out of the child and being accountable for their progress? Because what if the child's then making no progress?
Well, I think there's a couple of things there. I think one, if it's not working, you need to feel comfortable to have that conversation and call it. Like I think you need to be
Mm.
able to call it if it's not effective, which I think is very clear. We don't actually have that. I feel like but I really go through with my team the different considerations that you have to have when you're doing an external visit, because half of our business is external and mobile. So but there are lots of different considerations, like that you have to have a relationship with the educators, you have to communicate with the parents, you have to have an area that you feel comfortable doing your therapy in, and
Mm.
you have to advocate for what's best for the
Mm.
child, I think. And there's just certain things that, for hydrotherapy, for example, I like to have the initial in the clinic before you're going to the pool, so you can develop that rapport. You can do a risk analysis and make sure that you've got a good understanding of the capabilities of the child, and maybe some different behaviors. We have a lot of kids that do hydrotherapy that just want to be under the water all the time. It's this like sensory thing. They just want to be under the water. And you're like,
Oh gosh.
"Oh." Yeah. So it's a bit unnerving. So it's about providing our
Safety, yes.
clinicians with the skills to be able to, what I always say, and this is kind of across the board, is I'm like, you need to advocate for the child and yourself and setting yourselves both up for success. So, and I say that in terms of getting NDIS plans, in terms of collaborating with other allied health professionals, in terms of the environment, in terms of, making sure that you get an adequate initial assessment. We make sure that we have initial assessments before they can go into groups so that we really understand the child and the child's need before they're in a group environment, because that might not be appropriate for them. So I think it's our responsibility to clinically advocate for them based on our clinical judgment
And that's
in
because
all
what
settings.
with the goals and things. Yes. Yeah. So it has to come from based on the child. And there are things like that with speeches as well. Like we've developed a whole protocol at Speak About, because there are a lot of logistics with external visits, aren't they? But making sure that you feel safe, making sure that there's adequate parking, so you're not having to lug resources down 3 blocks. Making sure that you've got easy access, making sure there's no animals that would be threatening to you on premises. Like, I don't know, sometimes you can have a snake around the house, which I went to, not a clinician's house, but I went to a friend's house once and they thought it was okay to have a snake on the floor all the time. So if you're a clinician going to do that, you have to make sure that you've done your due diligence before you go to the visit. So we have a protocol like that we've developed at Speak About. It's not super extreme, but it is to make sure that our girls are set up for success. And I got a lot of tips actually. When I had Evie, the community nurse came out to our house, and I feel like she was really thorough. And she was like, do you have a driveway? Do you have clear access to the house? Do you have animals? How many people, who will be at home when I come for the visit? Is there any history of domestic violence at the home? Is there history of drug use or smoking in the house? I will show up between this time and this time. So having a little bit of a window for them with traffic and things like that. I will be bringing this equipment. Do you have a clear space for me? Like, the community nurse really opened my eyes to
that is really cool. Yeah.
How many questions were to consider. And at the time with a newborn baby, I was like, oh my gosh. But then I've gone, okay, well, this is the same for our therapists. And it doesn't matter where you're going, like whether you're going to the home environment, school, preschool, sporting activities, swimming, whatever. You need to make sure that you've got your wits about you. And as a therapist, you've covered all your bases. Is insurance needed at the venue? Does your insurance cover that? All those practicalities, which we've just got in a system now.
And the other thing too, that we have come across, probably because we've started to go into more and more, is just like that first time you need more time to be onboarded onto whatever system they're using. Sometimes they get you to do some like training that you just have to sign off on. You need to have a name to, like, what's the protocol at that specific
for the
site?
Facility.
Yeah, because we go into special schools, and that protocol is a lot longer than, say, if we're going into just a kindergarten. So it's about allowing enough time, familiarizing yourself. I also have said for new sites that an observation session initially is
we've said that
probably,
too.
it's
before
probably ideal, so that we can actually, particularly if you're dealing like in a special school, you've got a group of children with high needs. It's better for our team to go and just it's like setting the expectation, isn't it? So it's just that we're going to come in, we're going to observe for that session, we're going to talk to the educators that are working with the kids, just find out what works, what doesn't work, so we can adequately plan and set ourselves and therefore their children up for success. That's what it just keeps coming back to for me.
Yeah, it is. And we have to think about the child first, and how is this external visit going to set them up for success and achieve success with their overall long-term therapy plan. I think for speeches, the big thing is to think about external visits, not just home and preschool visits, and what that looks like. And one of my wonderful mentees that I mentor her in her business. I saw the other day on Instagram, she was doing a session by the beach with her child. They were sitting on the grass. They were doing an AAC device, and the child obviously had some goals around that. But I was like, that is a beautiful example of an external visit. And obviously, it worked with their goals functionally. I think she said they were doing some vocabulary about the beach or something because that was important to the client. So, like, really stretch yourself and think about the child in mind, the principle of external visits, not just preschool visits or home visits, and think about where can I go to help this child. And I actually think activities that involve movement, like we've spoken a lot about that on the podcast, but I have seen that with so many children. A few years ago in Speak About, we created a program called Horse Talk, and we were doing speech therapy with the horses. And we saw so much improvement with children that we had been seeing for years and had been struggling to see improvement because obviously we had the equine-assisted therapy, so that animal, but also the movement. Like I was actually teaching language concepts while they were on the horse because it was like the movement of the horse was helping activate their brain and different parts. And so I would really encourage you as speech. Yeah, like I don't know whether a preschool visit or a school visit would be helpful for a child if you're wanting to incorporate movement. So go and do a sporting activity. Go and like my daughters, they do a program called Ready Steady Go, which is amazing. And you could easily partner with the child in that, incorporate your language goals or incorporate one language focus in that 45-minute session with the child. Again, swimming lesson, you could, if the child was doing one-on-one, get in the pool with the child, with the teacher, and educate on the, and, use language with that. Movement is so powerful to help learning. So think about where your child is doing movement and try and insert yourself into those external activities, even with the EP sessions, rather than just doing a preschool and a school visit.
Well, yeah. And I mean, what we obviously do is we insert movement into the preschool. So we're getting them moving while they're in preschool and layering all our therapeutic interventions into that movement, because movement engages children holistically. Like it engages every single system. But I think what I think is important to maybe address is, one, when to know when to move it out of the clinic. Like, are there any signs of knowing when to move it out of the clinic? Like you're suggesting to look at, swimming and outdoor. So what are the triggers for you to go, oh, this might be a good idea to try that? What are the stages to going, oh, maybe we try an external visit? Like for us, we offer it. So that's something that is kind of, part of our offering. But we still have people that come into the clinic that we may then suggest hydrotherapy, or we may then suggest a home or a school visit. And most of the time for us, it's where they're either having difficulty and we feel like we can insert into intervention in or therapy into that setting and assist them during that difficulty. So we're either moving towards helping, like improving, or we're moving away from something that's not working. So perhaps the clinic's not working for whatever reason. Maybe it's someone else being there at the same time, or the time of day, or the environment. But is it that is not working for them, and now is a time to try a different alternative?
Pretty similar. I think it's really hard to give a stock standard answer, because the whole point is to think about the child and where they're at. So we're pretty similar. We would always do, for the most part, the assessment in the clinic to build that rapport and to see what's happening. As a part of the assessment procedure, we would maybe do an observation in there if we're finding like the parents are saying they're totally different at preschool, they're totally different in this setting.
Well, that's a reason you would do it, right? If the parents are saying, oh, they don't behave like this at preschool, they're having this and this and this at preschool, that would be a trigger for me to go, oh, well, maybe we need to go and observe it at preschool.
Yeah. So that would be maybe a part of the initial process.
Mm-hmm.
And then it's looking at what the goal is that you're trying to do. So I think for speeches, I mean, particularly if we're just speaking specifically about language, there is a lot of groundwork there that a
Mm-hmm.
child needs to have before they start generalizing skills. So we would, I mean, just traditionally overall thinking, you would be doing an external visit to help the generalization phase of therapy and helping children. They've learnt the goals, but then getting them to apply them functionally. So that might differ wherever they are in their therapy journey, and change. And that's not a stock standard answer. There are also other children where we've done an assessment and gone, okay, we're going to do a term of therapy with you at this external facility, so at home. Or also what my girls try to do actually from a logistics point of view is we try to do a lot of our visits in school holidays or different things like that in school holidays for the children. So I think that's good as well, because if they've had a block in the clinic, then we go, all right, let's like, if it's appropriate, let's do it over school holidays, or let's see how it goes first. So we always do 1 or 2 sessions to see how it goes before we commit to a parent and say, like, let's do external visits, because we don't know how the child will respond.
So yeah, I think that when we're talking about external visits, it's important to consider the child first, and what is in their goals, what we're trying to achieve, and the environment that is going to contribute to working towards those goals. First and foremost, there's obviously lots of different external visits that we can do, from different therapies to layering them into different activities that they do. And then, of course, in their early learning or school environments. And I think that's, again, just tying it into their goals. There's obviously different ways that businesses function and different offerings that they have. So that's a key consideration. But I think if we come back to what are their goals and what children need, when to perhaps move away from a clinic, and things to consider, and protocols that we can set up when we're talking about external visits. So I hope you guys got lots of strategies and enjoyed this session today, and it's opened your mind up about external visits and some considerations around external visits. And don't forget to like, share, and review our podcasts. We are just loving sharing our experiences with you, both professionally and personally, and would love to hear your feedback. Until next time, bye-bye.